Our next guest says stem cells are the most powerful anti-inflammatory available, including pharmaceuticals. This is one of the reasons stem cell therapy may help a number of conditions. Back with me today to continue our conversation about this promising treatment is Dr. Frank Lanzasera. Good to see you. How are you doing today?
Good morning. Good morning, everyone.
Yeah, so let's talk about this. You were saying since you've been coming on, one of the most popular questions you've been getting on the phone, and when people come in, they say, coming in their 60s, 70s, 80s, you say even 90s, going, am I too old? Is this still going to work for me?
Am I too old? And the answer is no.
I love it.
And we just had a 90-year-old woman. She could not get out of a chair anymore like this.
Wow.
All she wants to do is play with her great-grandchildren.
Yeah.
4 weeks ago, she had stem cell in both knees. She has Sjogren's disease, an autoimmune, so we put 1 cc also intravenous. And 4 weeks later, she's now getting out of her chair. Her daughter has video of her dancing with her walker.
Awesome.
Her pain is gone. So she asked the question, am I too old? The answer is no.
Well, and you talk about quality of life, and I think that's where people have been dealing with pain for so long and miserable, not being able to do normal everyday functions. That's what they want to do.
That's what they want. Everybody has different goals.
Yeah.
The beauty of stem cells, they're anti-inflammatory. We're using the umbilical stem cells. There's no surgery. Our nurse practitioner is an expert at injections. It's pain-free, and the results are quick.
So let's talk about some of the most common conditions. What I love, since we've been chatting with you here recently, is I just learned from you about the autoimmune disease portion of it. But talk about the different kind of conditions you're able to help.
So we're seeing degenerative arthritis, shoulders, knees, hips, chronic bursitis. And then some of those people have autoimmune disease along with it, rheumatoid arthritis, Sjogren's, some people with MS.
Yeah.
So we're seeing changes in blood work with stem cell therapy, decreasing inflammation, and at the same time decreasing their chronic joint pain, which makes them immobile.
Well, when we've been talking stem cell, I really do think is, you know, the way the future of medicine is going. It still may be relatively new for people to just kind of hear about this. I don't know if it's necessarily if you go to a general practitioner, if they're telling people all about it. What would you want people to know if they're watching this morning and in pain?
Well, they need to make a consultation to see if we can help them. We are scratching the surface with stem cell therapy, but we're seeing tremendous results for people with chronic pain. And they should use this. If nothing else is helping them, they should use stem cell therapy.
And I'd imagine maybe a lot of people are assuming that surgery is their next option or the only best option they have. If somebody's going down that road, what would you say?
If they're not a surgical emergency and they are skeptical about having surgery or another surgery, have a stem cell consultation performed because you may be able to avoid surgery.
You always say, you've always been very honest and said surgery may be the best option, but why not just get another second opinion?
That's right.
And see if there's something that you can do that would avoid that.
That's correct.
Let's talk about real quickly your new office. Obviously, the team is growing because you're having such great success, right?
Yes. Well, my wife loves Celebration, Florida, so we're opening a small office in Celebration for families that come down from up north, tourists, so they can have their stem cell treatment while they're on vacation.
I'm thinking you're going to have to open many more across the Bay Area.
Well,
you're getting so popular, doctor,
just two.
I know, just two. We don't want to keep you too busy. Well, if people, one of the other things you love doing is educating people about that. That's why you're on the show today. If people want to find out more, what's the best way to do this? I know you have seminars coming up. You're actually going to be at a women's expo at the end of the month as well.
The end of the month at the State Fairgrounds. If they go to betterstemcells.com, we list our seminars.
Okay.
We have them throughout Tampa, West Chase, New Tampa, Tampa Palms, Sarasota, and at our office every Tuesday we have a stem cell seminar, and these are free of charge for the public.
And this is where people can just come get their questions answered?
Right, they will not leave with any questions unanswered.
Okay, great. Well, again, we'll make sure and put the info on our website as well. Doctor, so good to have you in the studio. We love having you here.